Hi, we are Group 4 and we will be presenting our critical appraisal. The very first one would be presenting our outline for the presentation. We'll start off with the overview of studies included in the appraisal, and then followed by the appraisal tool utilized, then the summary of the results, and lastly the decision after the appraisal. So we'll go with the overview. The overview includes all 4 articles that was used by the group. The very first article would be the individual article used by each and every member for the worksheet. The other 3 articles would be the articles picked by pair to be used for this appraisal. So we'll start off with the article that was used by individual members of the group. It is titled Reliability and Validity of the Canadian Occupational Performance Measure for Clients with Psychiatric Disorders in Taiwan. This was published by the year 2003 and is of a diagnostic study design. The next one would be the Measuring Clinical Effectiveness in Mental Health is a Canadian Occupational Performance Measure and Appropriate Measure. This was published by the year 2002 and has the same diagnostic design, study design as the very first one. And then we have the validity of using the Canadian Occupational Performance Measure with older adults with and without depressive symptoms. This was published by the year 2008 and has the study design of a diagnostic study. Lastly, we have the validity of the Canadian Occupational Performance Measure, a client-centered outcome measurement. This was published by the year 2003 and has the study design of a diagnostic study. Now we will go to the appraisal tool utilized, and for this one we used the diagnostic tool. This was to determine the precision of the COPM by testing its validity and reliability, also to test its appropriateness in measuring clinical effectiveness in mental health. We shall be moving on to the summary of the results. The summary of the results shows the results for each and every article that was used by the group. So we'll start off with the reliability and validity of the Canadian Occupational Performance Measure for clients with psychiatric disorders in Taiwan. The group answered yes to number 1, 5, 10, and 11. Was there a clear question for the study to address? That would be a yes. Is the disease status of the tested population clearly described? That would be a yes. And then for 10 and 11, it will be a yes to the questions: can the test be applied to your patient or population of interest? And were all outcomes important to the individual or population considered? The research question of this article would be: is the COPM reliable and valid in measuring occupational performance problems for Taiwanese clients with psychiatric disorders? Having this question would allow the readers and other researchers to know what the objective or aim of the study is, even without reading the whole text. Clearly defined disease status and the patient's getting measured through the diagnostic tool would allow the practitioner to compare and contrast the inter-rater and intra-rater reliability as well as the validity of the tool through multiple tests. The outcomes which involves the measure of occupational performance and satisfaction of the client, would affect the intervention process as well as it would assist in planning for future activities and in identifying possible barriers in performing occupations. The next article that was used would be the validity of the Canadian Occupational Performance Measure, a client-centered outcome measurement. The group answered yes to question number 2, 6, 10, and 11. For the items fulfilled in the criteria, the test was compared to appropriate reference standard, which are DIP and SIP 68. Also, the method for research for the each assessment tool were described clearly, including the scores and its criteria. COPM test can be applied to our clients since it can be used to assess the perception of clients' occupational performance and satisfaction with that performance. For the third article, which is measuring clinical effectiveness in mental health, is the Canadian Occupational Performance Measure an appropriate measure? The group answered yes to question number 1. Was there a clear question for the study to address? And then questions number 6, 9, 10, and 11. The questions respectively would be: were the methods for performing the test described in sufficient detail? Can the results be applied to your patient or population of interest? Can the test be applied to your patient or population of interest? And were all outcomes important to the individual or population considered? The study presented clear questions to be addressed. The study also presented a clear method in performing the test and the procedure done in completing the study presented. The results can be applied to patient or the population of interest, which is GAD, since it focused on mental health disorders. The test can too be applied since the test was deemed an effective tool for the population. The outcomes were important because this can improve their quality of life through determining the satisfaction and performance of the subjects. Next, we have the validity of using the Canadian Occupational Performance Measure with older adults with and without depressive symptoms. The group answered yes to questions number 1, 3, and 5, 6, and 10, and 11. Was there a clear question for the study to address? That would be a yes. Did all patients get the diagnostic test and reference standard? That would be a yes. Is the disease status of the test population clearly described? Yes. Number 6, were the methods for performing the test described in sufficient detail? Yes. Number 10, can the test be applied to your patient or population of interest? Yes. Were all outcomes important to the individual or population considered? That would be a yes. Having a clearly defined diagnosis of the sample and objectives of this research would enable other researchers and practitioners to know the validity of the tool on a specific condition, as well as its limitation and boundaries in terms of its measure. Describing the procedures in administering the COPM would enable not only the researchers but the population too in understanding what the tool is and how the results are reflected upon the individuals being tested objectively. Based on the outcomes of the study, it is implicated that the tool is not a diagnostic tool itself, but is a measure that would reflect every client's occupational performance. Despite having depressive symptoms, it was emphasized that every individual would have unique occupational performance concerns. Therefore, this tool would help practitioners in deciding an individualized plan for every client there is. So now we move on to the last part of the presentation, which is the decision after the appraisal. Our group decided to reject the article because this research study did not involve utilizing a gold standard and measuring occupational performance side by side with COPM. There is no concrete comparison as to which of the two would be better used. This research study does not present the population of those having anxiety as well. Instead, it caters to those diagnosed with schizophrenia. This is the reason that our group decided to reject the very first article that was presented earlier, which was used by every individual member of the group. So thank you for listening to our presentation, and we hope you have a good day.